On this episode of Veterans HealthWatch, we'll learn about enrollment and eligibility criteria for VA healthcare. We'll also talk to two veterans who can tell you why you can and should choose VA. Please join us. Welcome to Veterans HealthWatch, a program sponsored by the Veterans Affairs Maryland healthcare system that provides the latest health and benefits information for Maryland's veterans, their family members, and the local community. I'm Kenya Griffin. Nationwide, VA serves veterans of all age groups from all walks of life. Each veteran has a unique story about how they served in the military, and there are many different paths that lead veterans to choose VA for their health care. So today we've invited two veterans who are enrolled in the VA Maryland healthcare system to share their stories with us and give a little advice for those veterans who aren't enrolled in VA healthcare and why they should choose VA. And joining us today are Minta Davis and Dwayne Roper. Thank you both so much for joining us.
Thank you.
Ms. Davis, we'll start with you. Tell us about your service in the military and what led you to choose VA.
Well, I served in the Air National Guard for a little more than 20 years. I retired in 2002. Why I chose VA health care, I was at a point where I was tired of the traditional medical, because I had medical coverage through the government plan, and didn't feel that the doctors were really listening to me. But I also had colleagues or friends who were veterans. They kept saying, you know, you need to join the VA healthcare because you're eligible. And I didn't think I was. And then I investigated myself and found that I was eligible. And when I went into the office to sign up, the representative, she said, "Thank you for your service." And I kind of was shocked, thinking, what? You know, it was kind of news to me to hear that. But it was encouraging for me. And then, of course, I've had, you know, a long history in the healthcare system and really wouldn't turn back.
Well, I thought one thing you said was kind of shocking to me. You said you were kind of taken back when she said, "Thank you for your service." Why is that?
Well, you know, as a member, a service member, I wasn't around, I was around older veterans, but they knew the system, they knew what the benefits were, and I was too new and too young to understand the full benefit of being a part of VA. And they just were determined to keep me informed and up to date as changes came about, and they encouraged me. So I was grateful for that, and to realize that, yes, I am a veteran. And so, you know, it just made me proud to do that.
And why didn't you consider yourself a veteran at first?
Well, because I didn't think at the time that I was serving I was in that category. I always saw, when you said veterans, either in soldiers' homes or from hospice care. My dad served and was a veteran, but I never considered myself a veteran until I joined.
Yeah, we hear that. We hear that from women veterans a lot. They don't consider themselves a veteran. So I'm glad you're here to speak to our women veterans. So as a woman veteran, did you learn about the services specifically for veterans here throughout the VA?
Absolutely. Once I started with my primary care appointments, they said, "Oh, we have a women's team," and I've again shocked and surprised, thinking I have a team, you know. And so I went to my first appointment, women's wellness appointment, and they took me in. I felt comfortable to talk to them about certain things I wouldn't have shared ordinarily, and to have a team for women, that's important.
Yeah.
You know, we have a lot more going on in our lives, and it's just comforting to have that support.
Yeah, we want our women veterans to know that we take that into consideration, that women have unique needs. All of our veterans do, and our women specifically, we want them to feel comfortable when they come to the medical center.
Absolutely.
As a woman, as a veteran, and you said you used outside healthcare, how would you compare the services you received in the outside to the services you receive here in the VA?
Well, under the government health plan, you do have the freedom to choose your doctors, but it seemed like I was finding doctors who really didn't care about me as a patient. And if I had an appointment, the first thing, one doctor I recall, he'd have new prescriptions. Oh, I want you to try this, I want you to try that, without really looking at my whole condition. And it's totally different at VA, I feel. I came in, I kind of knew some of the family history that could be problematic for me, and I talked to the doctors. So communications through my primary care was most important, and they listen. The VA doctors listen, so that was a big difference for me.
And how long have you been using the VA Maryland healthcare
I came into the system in 2014.
So about 3-4 years.
Yes.
And you said you knew some of your history, so it sounds like you're an advocate for yourself.
You have to be an advocate, indeed. For me, in sharing that with the doctor, we could kind of look at my whole health, wellness, things I could do on my own without first being given a prescription. So that's important for me.
And I understand you graduated from the Telemove program.
Oh,
tell us about that, your experience
How
with that
exciting,
program.
yes. Now, the Telemove program, I'm really excited about, because it gives you more than just a manual to read and figure out for yourself. I had a dietitian who was walking right beside me as I was making progress. And if I had problems or questions or concerns about what to eat, portion control, exercising, so Telemove means move, they really brought a lot of information right to me. I didn't have to go to a meeting. I didn't have to upset my whole schedule to be a part of it. They could call me, give me the information, and then I was free to take that information and apply that into my program. And I was successful. After being on it a year, I lost more weight, because I had tried to lose weight in the past, and that was always the hardest thing for me. But the Telemove program made it so easy to just get on the bandwagon and do what I need to do, and I feel great.
Good. Well, we're glad to have you here and feeling great. And it's good to hear that VA offers a variety of services. It's not just, you don't just have to come if you're ill, that you can have a variety of services. Dwayne, let's go to you. Can you share with us a little bit about your military background?
I served 16 years in the United States Marine Corps Infantry.
My dad was a Marine.
Was he? Hey. It's only a small amount of us, believe it or not. I've deployed several times. Obviously, the known wars, Afghanistan and Iraq, multiple overseas tours to a lot of different places in the world. I'm not going to go into detail, but been to several schools, and it was good to serve. I enjoyed it.
Good. Well, how did you come to use the VA for
so during my out processing, my retirement seminar, they offered, or within the seminar itself, they had a VA representative show up, one VA rep and then one DAV representative, and they kind of walked us through the process in a quick. I mean, it was, you know what I mean, it was kind of like a crash course on the VA. About 2 hours after 16 years of serving, and some guys 32 years of serving, you getting 4 days of crunch time. So what I did was the DAV representative, VSO, offered after hours assistance. I got with him, and he kind of walked me through the entire process. And one of the things that he explained to me was the fast track program, which, at I think it's 180 days prior to separation, you can actually start your in processing for your compensation. You can get enrolled, start to get enrolled into VA and kind of work your way around. So that's kind of sort of how I ended up.
You talk about the crash course, but what had you heard about VA before you enrolled for healthcare services?
Let's see. So having guys that retired before me, and then obviously junior Marines that have gotten out, separated. Obviously the horror stories back in 2012, 11, so on and so forth. Just a bad rap overall, slow. Definitely would not go to the VA. I would use a private doctor. They don't treat their patients, all the stuff that was going on in the media at the time. So taking in consideration all that information and talking to, I actually talked to some folks who did have a really good experience. So the way I am is I want to figure it out for myself. So, I enrolled in the VA.
And how's the experience been for you?
It's been great, actually. I've seen improvements. I haven't really had any problems as far as scheduling appointments. The same thing she brought up. I moved from Hawaii to here. So I grew up in Southern Maryland, or DC, Maryland, VA, Virginia area. And moving back to this area, I really didn't know anybody because, nobody really comes up here from down there. And so moving here, the DAV guy kind of got me in contact with folks here and everything, and kind of walked me through the whole process here. I checked in here, and I mean, from the first day I stepped into this hospital here, the same thing. I got a greeting. I was never put in a position where it's, I wasn't directed somewhere to go to get assistance, and I ended up at Prairie Point. Seeing as that is the closest place to where I live at, and that's how I ended up here.
And the theme I'm getting from both of you is try it out for yourself. Yeah.
Yes.
Yeah. Try it for yourself. So if you had a choice and you chose VA, both of you, I'll start back with you. Why did you choose VA? Why would you tell someone to choose VA?
For me, VA cares. It cares about the patients. It cares about you as a veteran. And you need to advocate. You need to tell them and talk to them and communicate with the doctors, the specialists. They're there to support you. Absolutely. Yeah. Absolutely choose VA.
Thank you. Dwayne, what about you? Why'd you choose VA, and why would you tell someone else to choose VA?
One, it is, I found it seems to be a lot better. I've met a lot of nurses and a lot of doctors just in teaching classes here and things of that nature. And what I found was they actually care. And that's what I would tell veterans. They actually care about what they're doing. You might have that one person that could turn you off, but that's not everybody. And that's really the bottom line, what I've found. So, my team of doctors, same thing. They call me, they actually check on me. I might not have a checkup, but they'll call and say hi. You're normally not going to get that. And I have private insurance. I've got private health care for my family. I got TRICARE through Humana, I think it is now. And, they don't call to check on me or my wife, so those differences there, I think that's kind of what is keeping me in, with the VA. It's just very personable.
And we being VA employees refer to veterans as our veterans. I was telling a person I met the other day, she said her husband's a Marine and he just started using VA. And she said there was a nurse who prayed with him. He wanted her to pray with him. She prayed with him. And I said, yeah, we see the veterans as our veterans. That's how we refer to them. So we take the mission of caring for veterans personally and really seriously. So we're glad that you chose VA. Do you have anything else you'd like to add?
I would just like to say, you know, it feels like family because I don't have family. It's just me. My parents have long gone, so anytime I come into the facility, I feel like, hey, they're looking out for me. They're not going to allow, you know, my health to get derailed. You know, they're here to support me and help me along the path. Right. So I'm really just excited about being and staying with VA healthcare.
Well, thank you so much. Thank you both for your service. I should have said that first. Thank you for your service. Thank you for choosing VA and for talking to our veterans.
Thank you.
Thank you.
We're going to take a short break, but when we return, we'll learn about eligibility for enrolling in VA healthcare. So please stay tuned.
Join us for the Open House with Enrollment Fair in Town Hall on Wednesday, April 26, 2018, from 4 p.m. to 6 p.m. Town Hall from 4:30 p.m. to 5:30 p.m. at the Baltimore VA Medical Center at 10 North Green Street, Baltimore, Maryland, 21201. Veterans and their family members and caregivers are invited to attend this free event to learn more about enrolling with the VA for healthcare and how to make the most of the VA healthcare services and programs available to you. Call 1-800-463-6295, extension 6071 for more information.
Applying for the VA healthcare system is one of the best things you can do for your health and well-being.
A lot of veterans, for some reason, don't realize that they are eligible for VA healthcare benefits.
So we always encourage the veteran to call because each veteran is enrolled on a case-by-case basis.
Once I obtained the knowledge that I could enroll, I enrolled, and it's been a great decision ever since.
A veteran can learn more about eligibility for VA and healthcare at 1-800-463-6295, extension 7324.
Welcome back to Veterans HealthWatch. We've heard from 2 veteran patients who've chosen VA for their health care. Now let's take a look at the how-tos for those veterans who are not yet enrolled. Joining us from the VA Maryland healthcare system are Sherry Early, the Chief of Medical Administration Service, and Dr. Martin Garcia Buñuel, the Deputy Chief of Staff. Thank you both for joining us.
You're welcome. I'm glad to be here.
Let's start with you, Sherry. We know there's some veterans who aren't sure if they're eligible for VA health care. So can you tell us a little bit about the eligibility criteria?
Sure. Okay, so there are many criteria, so I'm not going to get to all of them, but I'm just going to give the basics today. The first is that the veteran has to do active duty military. So before September of 1981, they had to do just 1 day of active duty military, and after that September date in 1981, you have to have 24 consecutive months of active duty. Okay. Plus there are other factors involved in that. That's basically if a person is service connected, they've been rated for a service connected condition. We also have other factors that include their income or probably some other eligibility, such as if they're on a pension.
And I know we use priority groups in the VA when we talk about our veterans. So can you explain that a little bit for us and tell us about the priority group 1 versus priority group 8?
Right. So we have 8 priority groups 1 through 8, with priority group 1 being the highest level priority group. So for instance, the majority of the people that are in priority group 1 are those that are 100% service connected, or 50 to 100% service connected. The difference between that group and priority group 8 is priority group 8 people are those that have no compensable service connected condition, and they are below the minimum income threshold that the VA sets. So if you meet those criteria, but everybody just needs to remember there are other factors. Right. So just listening to this, if you think you don't meet those, still contact us and we can
try.
Check. Yes.
Yeah, and we also hear from veterans, why isn't VA available for all veterans? Why aren't all veterans just eligible?
We would love to be able to make all veterans eligible for VA health care. But because of funding restrictions and funding limitations, what we do is we put those people in those priority groups so that we can make sure that those who need the VA the most are able to be seen and treated here.
And so for a veteran, and you mentioned income as part of that criteria.
Yes.
So for a veteran who maybe applied a few years ago and they were denied or weren't found ineligible, what would you say to that veteran? Would you tell them to try again?
Yes, so we actually encourage our veterans to try again. So if you try to apply and you were ineligible based on income, we suggest please come back. There are many factors. Let's say a person retired and their income has changed, or you could have lost your job, or maybe your spouse is no longer working, because we do include the spouse's income.
Okay.
And it doesn't hurt to come back in and try, so we just encourage people to do that.
Yeah. And what about those veterans? And what about the veteran who doesn't even know where to start? I know there are multiple ways to apply. Can you tell us about some of those ways?
Right, so we try to make it as easy as possible. There are 3 ways they can apply. They can apply online, so we do have an online enrollment application that they can apply for. They can apply by mail or in person. In person, you can come to any one of our facilities and one of the CBOCs, the community-based outpatient clinic, and they can apply that way.
So that's phone, mail, online, in person?
Yes.
Okay.
So if anybody needs any assistance, they can feel free to contact the enrollment center, and
Great.
we'll tell you how to do that.
So now the veteran has applied, they've gotten the letter back in the mail saying they've been found eligible. What happens next?
Okay, so once the veteran gets a letter back saying you're eligible, the letter will include what priority group the veteran is placed in. Just contact us and ask for your first primary care appointment. Okay. And they can pick the location of wherever they want to be seen within the VA Maryland healthcare system.
Great. And Dr. Garcia, for those veterans who maybe think they have health insurance or they're already being seen in the community and they think maybe that prevents them from using the VA, how actually does it benefit them?
Well, we really see ourselves as part of the community healthcare system. So in this case, in the state of Maryland, we really are partners with the community. And having said that, obviously we place a great emphasis on our primary care, mental health care services, a lot of our wraparound services, as well as hospital-based and specialty services. So we're here to partner with the community. And depending on a veteran's specific situation, we can play a variety of roles in their lives.
So Dr. Garcia, once a veteran has completed that enrollment process, what are the next steps?
Well, as Ms. Early referenced, we really want to get you in and meet you and get you into a primary care appointment. So we have multiple sites around the state. We offer a choice of times of day for an appointment, providers who are male or female, and who may be located in more convenient places. So really want you to make an appointment and come in and meet your primary care team, or what we call your PAC team. And that's really the first step, and an exciting one.
And speaking of appointments, we know that the VA Maryland healthcare system and the VA in general was having some issues with timing and scheduling appointments and having those appointments available for patients. But I know that the VA Maryland healthcare system has made great improvements in that area. Can you tell us about that?
Well, yeah, we've had great support nationally from the Veterans Healthcare Administration, as well as really from our community partners, as well as from our local leadership. We've been able to hire more doctors and nurses and social workers and mental health care professionals. So we've really been able to bolster the teams throughout the state to provide services. And when we're able to provide those number of teams, we've been able to really give appointments to veterans quite easily, yeah. Whether they're new patient appointments or follow-up appointments. So it is a great success story, and one that we continue to work on every day to make sure that we can take care of everybody when they need to see us.
And what about a veteran who has been seen in the community for a while and they come to the VA? What would you say are some of the advantages to receiving your health care in the VA for a veteran?
Well, exactly. I think exactly that. We are a home. We are a home for our veterans. We are a medical home. We are a place where veterans can come and feel like this is truly their place. That's why we all come to work every day to take care of veterans. So yes, we're more familiar with the veteran experience, both during active duty, transitions in life, transitions from service, and therefore we do offer a variety of backgrounds of practitioners and types of services that can address the veteran where they are at that point in their life. And I think, as our guests have previously stated, all of our sites are a place where our veterans feel welcome and they feel connected, both to each other as well as our staff, because that is our mission.
Mm-hmm. And so we want to take some time and dispel some myths about VA. So if you two could help me with that, some things that we've heard some veterans voice. Okay. So one is, I won't be eligible for VA care because I didn't fight in a war.
Okay,
Sherry?
so that is definitely a myth. As I stated on the first question that you did ask me, as long as you served active duty military, you didn't have to be deployed, you didn't have to fight in a war. Believe me, even being at home, you still served your country well, and you deserve to be treated at the VA.
Great, great. So the next one, by not enrolling for health care myself, I'm leaving space for another veteran who really needs it. What would you say to that one?
We do have a lot of people who believe that, but what I want to say is everybody deserves the care that they've fought for. And the VA, if you're enrolled, we're not going to treat any veteran different from another veteran who was enrolled. And we'll make sure that we can provide care for every single person who enrolls. So we're just asking, please just come and enroll so you can get the best health care around.
And I'd like to add too is that the more we can help, the more resources we get.
Yeah, absolutely.
So the more veterans we help, that actually helps our community of veterans. So as we really do advocate, the answer I always like to give is come and ask for help. Let us help you. Yeah. That will allow us to advocate for you and get you and the rest of the veteran community the services they need.
Absolutely. And Dr. Garcia, this one's for you. The VA is for men. It really doesn't cater to women.
Well, that one's an easy one because the fastest growing population of veterans that we have and that we're serving are women. We now have a dedicated women's health clinic. We offer multiple on-site services for women. I can tell you that when we recruit employees for the VA Maryland healthcare system of all professions, one of the areas we really look into are those individuals who have experience, interest, competency in taking care of women. And so we really have turned the corner and continue to really want to wave that flag to have female veterans come and get their care here.
And what about care isn't as good in the community? Care at the VA isn't as good as care in the community. What about that myth?
Well, we are a highly measured and monitored healthcare system throughout the country. And given that, we can actually compare ourselves rather easily to what goes on in the community. And what I can tell you is we compare favorably to the community, the care given in the community. And then the other thing I'd like to add is that we want you to come in and try us out. Yeah. I think you'll find that if you come in and you meet us and you meet all the dedicated men and women that work here and serve the veterans, that quality of care will come through quickly. One, in the technical parts of delivering healthcare, but also in the component of providing compassionate care with a soul and a heart for veterans.
I think that says it all. Yes. So thank you both again for joining us today to explain how eligibility works for the VA, how the VA Maryland healthcare system treats our patients. We really appreciate what you do every day and for spending some time here with us.
Oh, thank you. And I want to just say I just love what I do working with the veterans here.
Thank you, Sherry. And I know you've been working, how long have you been with the VA?
27 years, and love every day of it.
Good. Thank you so much.
All right.
Well, that wraps up today's show. If you have questions about today's topic or would like to make suggestions for future topics, please give us a call or visit our website. You can also follow us on Facebook or on Twitter. And remember, if you are a veteran or you know a veteran who is not using the VA Maryland healthcare system, please stop by one of our facilities, call us, email us. We look forward to serving you. Please join us next time.
It's important to get a new flu shot every year. It's very easy to do, and it can protect you or a loved one from getting sick. People who are at high risk for the flu are those who are over age 50 or those who have underlying heart or lung conditions.
The flu vaccine is offered free of charge. We do the vaccination in various clinics.
You don't need an appointment. You can walk in and get a flu shot when you show up. Thousands of people die from this and is preventable by a simple vaccine.